Today, we're going to talk about a journey. It's a journey that starts in the very first weeks of a new life, and it ends up shaping a person's smile, their speech, and so much more. This is the story of cleft lip and palate, and we're going to explore it from the very beginning.
So think about this. Deep in the first trimester of pregnancy, a series of incredibly precise events are supposed to happen to form a baby's smile. But what if that process gets interrupted? Well, that moment sets in motion a lifelong journey, and that's why this isn't just a medical condition, it's a profound developmental event that starts before most people even know they're pregnant. It's pretty incredible when you stop and think about it.
So to really understand this whole journey, we've got to start with the basics, right? We need to look at the blueprint. What exactly is a cleft?
Okay, so it really comes in two main forms. First, you have a cleft lip, which is a split in the upper lip. Then you have a cleft palate, which is an opening in the roof of the mouth. Now, these can happen separately, but more often than not, they actually occur together, and when they do, they create a direct opening between the mouth and the nasal cavity.
The signs are usually obvious right from birth. I mean, besides the visible opening, the most immediate challenges are all about function. A baby might really struggle to create suction to feed, which can sometimes lead to milk coming out through their nose. That same opening can also lead to some really painful and recurrent ear infections.
So how does this even happen? Well, the origin story of a cleft goes way back, to the very first weeks of pregnancy. The timeline here is incredibly precise, and it happens so early on. The timing is just absolutely crucial. Get this, the lip forms first, fusing at around weeks 5 to 6. Then the palate follows, and it's meant to close up between weeks 7 and 12. The best way to think about it is like two sides of a zipper. They're supposed to meet perfectly in the middle, but for some reason, they just don't fully connect.
So what causes this interruption? The truth is, it's rarely just one single thing. Science tells us it's what they call multifactorial, a really complex mix of genetic predispositions and different environmental factors during pregnancy, things like smoking or certain medications or even a lack of folic acid. It's really not about blame, it's just about a perfect storm of events at a very critical moment in development.
All right, so once a baby is born, the very first and most critical challenge is nutrition. I mean, how do you feed a baby who can't form a proper seal with their mouth? It sounds incredibly daunting, but the good news is the solutions are both pretty simple and really effective. See, feeding is all about creating a vacuum with the mouth to draw milk out. That opening from a cleft, whether it's the lip or the palate, it breaks that seal. It makes it pretty much impossible for the baby to generate the suction they need to breastfeed or even use a standard bottle.
But here's where technique saves the day. By sitting the baby upright, you use gravity to your advantage. You use specialized bottles that don't even require suction. And you make sure to burp the baby frequently to release any extra air they've swallowed. With these steps, caregivers can provide all the vital nutrition that baby needs to grow, thrive, and get ready for surgery.
Okay, so once a baby is feeding well, gaining weight, and getting stronger, the journey starts to build toward that next major milestone, surgical repair. But this isn't a race to the operating room. It's a very carefully timed process. Before any lip surgery can happen, that baby has to be strong enough. And surgeons have this simple but brilliant checklist they use to make sure everything's safe. It's famously known as the rule of tens.
First up, the baby has to be at least 10 weeks old.
Second, they've got to weigh at least 10 pounds. That's a key sign that they're thriving.
And finally, their hemoglobin level has to be at least 10. This basically makes sure they aren't anemic and are healthy enough for successful surgery.
So once the rule of tens is met, the lip repair usually happens around 3 months old. But the palate repair, that comes much later, somewhere between 9 and 18 months. Now you might be wondering, why the wait? Well, it's actually to let the baby's facial structures grow. It gives surgeons more to work with, which means a better long-term result. And the journey might not even end there. Sometimes more surgeries are needed years later to help with speech.
Surgery is a huge step, no doubt about it, but what happens right after is just as critical. The road to recovery requires some incredibly specific care to protect all that delicate repair work. And this is where things get really different depending on the surgery. After a lip repair, the baby has to rest on their back. And they might wear these soft little elbow restraints to keep them from accidentally touching the stitches. But after a palate repair, it's the opposite. They'll lie on their side or stomach to help with drainage, and absolutely nothing hard. No spoons, no straws, no pacifiers is allowed in the mouth.
You know, it's so tempting to think of surgery as the finish line, right? Like, okay, we did it. But it's not. It's a massive, critical milestone, for sure, but the real long-term success depends on a whole team of specialists working together for years to come.
And this is what that comprehensive care really looks like. It takes a village. You've got speech therapists helping a child learn to speak clearly. You've got orthodontists managing how the teeth and jaw grow. Audiologists are there to check for hearing loss, which can be a side effect of all those ear infections. And just as important, you have psychological support for the child and ongoing education for the parents, who are, let's be honest, the true captains of this entire team.
Look, as a medical community, we've gotten incredibly good at the how of all this. The surgical techniques, the feeding strategies, we've got that part down. But the journey is about so much more than just physical repair. So the real question we have to ask ourselves now is, how do we best support the whole person, medically, emotionally, and socially, to make sure that a challenge that starts in the first few weeks of life doesn't end up defining a lifetime?